Hello? Are you going to come and say hello? You're busy watching outside. You're going to come and say hello? Hello. So I'm just getting to know the cat a little bit, and so she's not too worried when I do the health check. So we're just getting to know each other a little bit. I'm just offering my hand so she can have a good sniff. And oh, she's rubbing her hand on against the back of my head, against the back of my hand now. So I can say we've made a bit of a connection, and you're happy with me. I have washed my hands first, and I've allowed the sanitizer to dry, so that odour isn't off-putting to the animal. Are you okay? That's it. We seem to have made a connection, so in the next shot I'll do the health check. That's it, you're nice and relaxed. Okay, so now we're going to complete the health check. We're still having a bit of familiarisation. We've taken the bedding from the cat's environment onto the table where we're going to do the health check, just so the cat's familiar with her own odour and helps relax her a little bit. And we know that cats aren't quite so fond of being handled as dogs, so just have to make sure that we kind of do the inspection as we're fussing the animal and giving them a bit of attention, so it doesn't feel too much like a health check. So just spend a few seconds just building that bond and getting that trust. So she's starting to sort of headbutt me and putting her head against my back of my hand and showing return affection. So we know that the cat's nice and relaxed and comfortable. Okay, so the easiest one seems to be for me to start with the ears, and you just gently pull the ear back. It's a bit tickly, so we will be careful not to upset them, but they're nice and clear, there's no discharge, that's alright. She's pulling away a little bit, so that obviously indicates that I don't really like that very much, so we quickly do that one. And I'm going to just fit with a cat. Obviously they've got, especially with long coats, they've got a little bit, it's a bit harder to see the condition, so just run your hands down again, just like you're stroking them, and you can feel the cat is, you can't feel the ribs too much, but there's enough of them to indicate that the dietary requirements are being met. That's it. Okay. While your tail's up, I'm just going to have a look around the back. Sorry, I'm not being too rude, am I? And you've got no discharge and there's no redness there. Okay, so look at your beautiful eyes. Show me your eyes. You're going to look up. I've got some treats. Where have I put my treats?
Just above you.
Oh yeah, I'll give you one of these and then you'll look up, won't you? And I can see your eyes. Whoops, I dropped it. There you go. So I put it there for you. Okay, we did get a look up. Lovely bright eyes, no discharge, no greyness in the eyes, look perfectly healthy. So with a cat's claws, they're slightly more difficult to see because obviously there's a lot of, they retract. So I'm just going to run my fingers over, if you don't mind, do you? That's it, I know. That's it. Oh yeah, okay. So we're not going to do too much of that because obviously we're not comfortable with that, are we? No. So yeah, I can feel they're not excessively grown, and no problem putting the paw to the ground, so moving quite freely. Now this might be a bit difficult. I think I'm going to do it with a treat. I might need to take this one from it. Can I have a look in your mouth? Yeah. You going to let me have a look? Okay. We've not experienced any problem with eating the treats, and I seem to have to put them down to get you to take them, don't I? But I'm just having a quick look now. I can see a bit more. Gums look nice and pink. The teeth look okay. There's certainly no discomfort while eating, so we're happy with that. And so we've done ears, we've done your mouth, eyes. So look at your nose. No discharge from the nose, and you look quite happy with that. We've done your body. Right, the other thing I was checking when I was going down the body, I'm checking for no lumps and bumps, no scabs or anything like that. or any loss of fur where we might have something going on. So that all looks fine. I'm just going to have a look underneath. Okay. Female cat, yeah. So the other thing is, sometimes mammary glands can be a problem. So I'm just going to have a feel underneath. I'm sorry, I'm not being too personal, am I? No, there's no swelling, or it's hard to see if there's any redness, obviously, with all this coat, but there's no swelling under there. And
I'll just pause.
so that completes the health check. So the things I'd be looking for if the cat was possibly unwell is, are they lethargic, or are they a bit restless, they're not eating, or they're eating less, or they're drinking a lot more than what they normally would, or they're just keeping themselves to themselves, they don't want to be fussed, or anything out of the ordinary with their behaviour really. But you've been a perfect patient, and you've done very well indeed. I'm going to pop you back in your environment now so we can just make a little assessment of before your 5 welfare needs are being met. Alright, thank you very much. Right, so now I'm just going to have a look at the environment of what Tallulah has got, and just assess that. There's a good locking system on the outside, so it's nice and secure. I'm just going to release that and have a quick look inside without letting the animal out, hopefully. Right, okay, so inside we've got a scratching post. First of all, it's a nice, easily wipeable, cleanable surface, sealing walls, which help with keeping it nice and hygienic. There's fresh water inside, scratching post for enrichment. We've got a nice soft bed with ample blankets. Food has been provided. Nice, lots of little toys for enrichment. I'm looking through, because this area goes into an outside area so they can freely exercise. There's different levels of equipment so the cat can exhibit normal behaviour. Obviously with cats, they're quite territorial, and when we talk about the need to be housed apart with other animals or apart, it's probably true to say unless they're from the same household, they're not very good together, and they like to be on their own. So that's what the setup is, so we're quite happy with that. I need to inspect outside, but there's nothing in here that presents any potential hazards as far as pain and suffering is concerned. Nice smooth surfaces. I will go outside and have a look at the outside exercise area, but nothing in here would concern me, and I wouldn't recommend any improvements. Okay, so I've just come outside into the outside exercise area where Tallulah has got access to. I can now witness better the multi-level equipment so the cat can achieve or exhibit normal behaviour. Nice and clean. We've got some artificial lighting that is available, and obviously it's temperature regulated when the cat needs it, because they can go back inside to the internal area. Nice soft bedding again, plenty of enrichment, nice secure doors, and we've got a double door system, so if the cat was to escape the enclosure, there's a secondary door to secure the animal. Thank you.